Hi, this is Dr. Mitch Chasen from Reflections. And in part 2 of our video on state-of-the-art injectable fillers, we're going to talk not about the good, not about the fun, we're going to talk about the bad. We're going to talk about the complications and the bad outcomes because they're really important to understand. And the good news is that the vast majority of the bad outcomes are completely preventable. If you like this video, please remember to give us a thumbs up and subscribe to our channel. And on the right side of the screen, you'll see valuable links to different resources in the field of cosmetic medicine. Thanks for joining us. So the purpose of this video is to educate you not only as the patient, but as the consumer. Because done well, these injectable fillers have a wonderful effect, not only on our appearance, but on our self-confidence, on our just state of happiness overall. But when done poorly, it could really be a problem. So one can see lumps and bumps, and one can see even permanent complications if they're not done well. And it's not usually about the filler, it's about the technique. It's about how we inject these fillers. It's about the anatomy of the patient that you're injecting these fillers on, even their mannerism, how thick their skin is, the ethnicity of the person. There's many factors that become involved in delivering a knockout result. And if those factors aren't realized from lack of experience, bad outcomes occur. And we'll talk about some of those bad outcomes, but again, some of those outcomes can be where someone just doesn't look right. They look overinflated, they look unnatural, and some of those are just lumps and bumps and swelling in different areas, and some of them are catastrophic, even blindness, ulcerations in skin, scarring, bad stuff, and people do need to be aware of those. In our practice today, we use dozens of the available fillers on the market, and we inject hundreds and hundreds of different places on the face. And to do that safely and effectively requires a knowledge of underlying anatomy. It requires ability to assess a person looking at their sex, their ethnicity, the thickness of their skin, their mannerisms, their repetitive motions, their degree of sun damage, their age, many factors. And with that information together and experience, we can deliver amazing results. We'll talk about some of the bad results and why they occur. Number one, lack of experience from the injector. If someone doesn't have the knowledge and the experience to assess properly, they're never going to have a good result. So when we talk about bad outcomes in dermal fillers, the first category is lack of result. So what's the common reason that someone just may not see a result? And the answer is they may not be a candidate in the first place. If a patient comes in and they have a crease over here, and that crease is from loss of volume from the cheek above, and you put filler in the crease, you're not going to see a change. So it's generally lack of knowledge on the part of the injector. Secondly, use of the wrong filler for that job. If we're trying to volumize, we need to use specific dermal fillers that are volumizers. If I use a line filler instead, it's not going to work that well, and I'll need 10 to 20 times the amount of it to create a result. So an inexperienced provider is not going to be using dozens of fillers like we do. They'll use one or two, and unfortunately they may be using the wrong one for that job. The second is lumps and bumps and swelling. If we use the wrong tool for the job, if we use a filler that absorbs water and we use it in an area that's very close to the surface of the skin, it may absorb water and create a lump or a bump. Okay, that is an avoidable complication. So the right technique and the right use of the tool for the job is going to avoid that problem in the first place. Another complication we're going to talk about are unnatural looking results. Well, why does that occur? Very often it's from focusing in on one area of the body without looking at the other adjacent areas. So we need to look at the face as a whole when we make changes to each of its components. The second thing is, if a little is good, doesn't mean more is better. There's not a day that doesn't go by when I'm slowing people down and saying, no, that's enough. You look great. You don't need more. And part of the reason is when they go home after being injected the first time, they feel so good. The natural tendency is to say, well, let me do more. So we try to talk about other things maybe they can do to feel better, using technology to rejuvenate the skin, topical therapies, other kinds of things that are anti-aging in nature. But it doesn't mean we need to do more filler. One of the things I view as a complication is unnecessary downtime. Bruising, swelling, these are things that can be avoided. There are devices where we're able to look under the skin and see where the veins are. Once I see where the veins are, I can mark them and I can avoid them. Secondly, we may pre-ice the skin to decrease the dilation of the blood vessels to avoid bruising. If we're using a dermal filler that may swell, we want to make sure we're using that dermal filler deep underneath the muscle or underneath the fat. If we're using something on the surface of the skin, we want to use a thin filler that doesn't absorb water. So picking the right filler and using the proper technique is a big part of avoiding unnecessary downtime. So most of the complications that we've talked about so far are secondary to wrong selection of filler for what we're trying to create and bad technique, which is usually due to lack of knowledge or lack of experience on the injector's part. We now want to talk about the real bad, the true complications. One needs to know anatomy extremely well to know where these fillers belong and, most importantly, where they don't belong. Underneath our skin are blood vessels, our nerves, and it's the blood vessels that we worry most about. So how do we avoid injecting into these blood vessels? Again, one is knowledge of anatomy. Number two, in an area that has these blood vessels that we want to stay clear of, instead of using needles, which are sharp and can penetrate vessels, we want to use dermal cannulas, which are these thin, blunt little instruments that are much safer. And not only are they safer, they hurt less, they cause less bruising, less swelling, and consequently, less downtime. So we use cannulas for most injections on the lips, on the cheeks, on the forehead, especially areas that are areas at risk. And the highest areas at risk are in the central part of the face. So when you're going for an injection in that part of the face, ask the treating physician about the use of cannulas. If they say they don't use cannulas, think twice about having them inject you, because that's a state-of-the-art way of injecting those areas. So the area of injectable medicine within the field of cosmetic medicine is an incredibly satisfying one, both for the patient and for the practitioner. There's nothing more satisfying than performing an injection and watch people's eyes light up when they look at their face, or when they come back a week or two later and just say they just feel so much better about themselves. They feel rejuvenated, they feel rested. People have been complimenting them about how they look, but they can't tell that anything's been done. And that's what we want the results to look and feel like. But aesthetics and aging is a journey, and it's something that changes over time. So we want someone to form a bond with a physician that can not only respond to what they see aesthetically, but to what bothers you individually. And when we put those things together, we can achieve great outcomes. And that journey is one that we want to participate in. We want to take that trip with you. And it starts with a consultation. We want you to come in, explain to us what bugs you, what you want to tweak. And it's a partnership, and it's something that we're going to give you our feedback. We're going to tell you what the world sees. Sometimes they're the same, sometimes they're different. But as partners, we want to achieve an outcome that makes you feel better, not only on the outside, but more importantly, on the inside.